Good morning, doctors. Thank you for taking the time to join us today. Let me start with a but serious question. How often do we think about our patient bone health before a fracture happens? Osteoporosis is often called the silent thief because it weakens bone without symptoms until it's too late. In fact, 1 in 3 women over 50 will experience an osteoporotic fracture. That's a huge number, and sadly, most of these cases go undetected until the damage is done. Today, I'd like to introduce a smarter, faster way to screen for osteoporosis risk using AI, designed for everyday clinical practice, especially in primary care. It's a game changer and it may help us prevent fracture before they happen. Let's take a closer look. We will talk about two topics today, as in osteoporosis and AI bone screening software, very OsteoOP. On this slide, we want to highlight why osteoporosis is often called a silent disease and why it matters now more than ever, especially in Malaysia. As pointed out by Dr. Lee Jun Keong, a leading orthopedic surgeon, osteoporosis is becoming increasingly common in our country. Shockingly, 80% of patients who suffer bone fracture due to osteoporosis are never diagnosed or treated. That means they are much higher risk of experiencing another fracture, often within just 2 years. Looking ahead, by 2050, Malaysia is expected to see a 3.5 times increase in hip fractures, the highest rate in all of Asia. And this comes at a cost. Each hip fracture hospital stay average 24,000 for just 7 days. And the total projected burden to our healthcare system will reach over 530 million. What's even more concerning is that 96% of Malaysians don't even know the risk factors of osteoporosis. So we are dealing with a condition that's not only underdiagnosed but also under-recognized. The key takeaway here is early screening and prevention are essential. By identifying high-risk individuals before they break a bone, we can reduce suffering, save life, and lower healthcare costs significantly. Let's begin with a quick overview of osteoporosis. Osteoporosis means porous bones. It's a condition where our bones become weak and brittle over time. Often it happens silently without any symptom until a fracture occurs from something as simple as a minor fall or even a sudden movement. Most Malaysians actually are really not aware of what osteoporosis is, and they all feel like only if your joints are giving you trouble or if you have pains that when you actually have osteoporosis. And that's really a common misconception and lack of awareness. So osteoporosis is really where your bones loses its strength or loses its density, and with time that predispose you to a fracture that can happen with just a simple trauma, like just by slipping and falling down. That's how serious it can be most of the time. Most people don't have any symptoms until that happens. So it's really not, we are talking about joint problems here. We are talking about bone strength and bone density here. As we age, especially after 40, and more so after menopause, our bones start to thin and become more fragile. It's a little bit like if you could imagine your bone to be a structure of a honeycomb. So they are, it's quite strong, but there are some holes there, and as you get older, these holes become bigger. So the structure sort of like scaffolding that is breaking apart slowly, and there is become more pores. There's a bit more space, a bit more holes, and in the end it becomes a consistency of a sponge. That is when even simple action like lifting a flower pot or sleeping in the bathroom can lead to fracture. In the scientific sense, when we talk about bone strength, it depends on two main things: bone density and bone quality. Bone density refers to how much mineral is in the bone, which is what we measure using a DEXA, or now today you can use very osteo scan. Bone quality refers to the structure and condition of the bone. Bone strength depends on both density and quality, and both decline with age, especially after menopause. If you are a woman over 50 or a man over 70, you are a higher risk of osteoporosis. In women, this is due to hormone changes after menopause. In men, bone loss also happens gradually due to lower hormone level with age. If you are in the risk age group, screening is important because osteoporosis often has no symptom until a fracture occurs. Warning signs that people often ignore include loss of height or becoming more stooped, as in the picture you are seeing now. This may signal spinal fracture that happen silently. If you notice an older person getting shorter or hunched over, it's not just normal aging. They should get a bone scan or x-ray done. Spinal fractures are often the first sign, and they increase the risk of more serious fracture like hip fracture, which can lead to severe disability or even being bedridden. So early detection is the key to preventing serious outcome. So why women after menopause are at risk? Osteoporosis is more common in women. About 1 in 3 women and 1 in 5 men are affected, according to the International Osteoporosis Foundation. The main reason is the sudden drop in estrogen after menopause, which accelerates bone loss. Men also lost hormones, but more slowly, so their bone loss tends to start later, around age 60 compared to 50 in women. However, when men do get fractures from osteoporosis, the outcomes are often worse than in women. That's why you often see more awareness targeted at women, but men shouldn't ignore the risk either. The problem is many people only discover they have osteoporosis after a fracture. Our goal should be to be screened early and prevent the first fracture from happening. So what we should watch for? Most medical guidelines recommend bone screening for women after menopause, usually around age 55, and men from age 65 to 70. A DEXA scan or very osteo scan today uh, can be done every 2 to 3 years. Helps checks both your bone mineral density and puts you into one of these three zones. Green, normal; yellow, low bone density, or we call it osteopenia; and red, osteoporosis, which is you need treatment. If you are in the golden age group, screening is key, but prevention starts early. Getting enough calcium, vitamin D, and regular exercise in your 30s and 40s builds stronger bones for later life. Strong bones in old age starts with good habits when you are young. To protect our bones, nutrition is key. We need enough calcium and vitamin D daily because they are like the building blocks, the cement and stones of your bone. Many Malaysians don't get enough calcium, which is found in milk, cheese, ikan bilis, and green vegetables. If your diet lacks calcium, supplement can help. Although Malaysia is sunny, most of us spend time indoors, like in malls, so we don't get enough vitamin D from the sun. Sunlight is the main source of vitamin D, but as we age, our skin make less. So good food sources include salmon, mackerel, egg yolk, and affordable options like sardine. And also many Malaysians also actually uh, need vitamin D supplementation. Vitamin D levels can be measured as well in blood. So there are guidelines for that you could do in a test in local lab. And if patients are really deficient, then we would need supplementation of vitamin D. So these are in terms of building blocks. Another thing, if you are at risk, or if you are postmenopausal, if you are an older man above the age of 60, then of course very osteoporosis or further DEXA scan, which is bone density scan, it can be done. That should be done as a screening test, because that is the best way to pick up osteoporosis, number one. And of course, if patient have symptoms as well, some of the symptoms could be very blur, like lower back pain. So make sure we provide medical advice and x-ray may be done. And if an x-ray actually confirm fracture, then you will need a bone density uh, scan as well. So the other thing about, besides calcium, vitamin D, bone density, another important thing is of course exercise. That's always important, again, from young until old. Even if you are 80, you should still be exercising. So simple things like what we call weight bearing in medically is like walking. Simple as walking, tai chi, yoga, things that are more fitted to your lifestyle. So that will definitely help to prevent further bone loss, keep our bones stronger.